It's now streaming live. Meeting is now streaming live on Facebook.
Are we live?
That's what it says.
Yep. Are we live? Okay, thank you everyone for your patience. We had some technical difficulties. I am actually hosting this Facebook Live from Brazil and Marianne is in Toronto. So thank you so much for joining us here today. My name is Marianne Bracht. I'm the Executive Director of the Canadian Premature Babies Foundation. Our foundation is really committed to continue to educate and support families of premature babies. And we're starting today our Facebook Live. We're going to be doing this weekly, perhaps bi-weekly, depends on the demand that we have. And you're going to bring experts to discuss parents' concerns and answer some of the questions that you might have during this very difficult time. So please continue to send us. Ooh, sorry for the noise. So anyway, we are going to continue to please continue to send us topics you are interested in, and we'll do our best to have all of them addressed. Also, every Wednesday from next week, March the 25th, Kate Robson will be hosting a real-time peer support groups for families on Zoom. We will be sending the links. We're going to be posting the links on our social media channels, so please stay tuned. And today we have here with us, actually in Toronto, Marianne Bracht. Marianne is a retired neonatal nurse. She was the parent resource nurse and the RSV coordinator in the ICU at Mount Sinai Hospital for many decades, including the time we had SARS in Toronto in 2003. Marianne now is a volunteer at the Canadian Premature Babies Foundation. She's the chair of our Family Ambassador Committee. Welcome, Marianne, and thank you so much for joining us here today. This is certainly a very stressful time for all of us, and we all know that in ICU parents worry even more about any viruses, as we know how vulnerable our babies truly are. So I will start today by addressing the most common questions that parents have sent to us. And Marianne, are preterm babies at a higher risk during this COVID-19 pandemic?
Hi, everybody. Some of you may remember me from a few years ago, and welcome to those who I don't know. Are preterm babies at higher risk? All babies, especially preterm babies, are at higher risk in the first year of life if they get a respiratory infection. And the reason is that they were born prematurely with immature lungs and they have an immature immune system. And of course, the lungs continue to develop up until 8, 9 years of age, and the immune system gets better. But the first year for sure, they're at higher risk. Now I'm going to say that all children, this is what the current thought is, under 5 years of age, and that includes full-term births as well as premature births, they appear to be a little bit more at risk and can get a little sicker.
Marianne, but we've been getting also questions about how COVID-19 can affect children who has chronic lung disease or BPD. Can we talk about that? Is there any data available at this point?
Okay, so the thing about chronic lung disease, a lot of very premature babies do get that diagnosis and do go home with that diagnosis. And they're all different degree levels or severity of chronic lung disease. So some babies who have a diagnosis of chronic lung disease may get a cold in their first year, may get a cold in their second and third year, and they are totally healthy, run around eating well and doing well. There are other babies that were born prematurely who have a diagnosis of chronic lung disease, and they may get quite sick if they get a virus. And of course, all of you will know, or most of you will know about the respiratory virus called RSV. And so these babies can be sicker if they catch this virus or any other viruses. What I'd like you to do, if you are worried and your baby or child got a diagnosis of chronic lung disease, is to talk to your pediatrician or your family doctor. If they have been totally healthy with all the colds that they've had in the last couple of years, I suspect that that will continue, but I need you to speak to your family doctor and pediatrician if you're concerned about your specific child, because I absolutely cannot give anybody any information. It can only be general.
Marianne, we are going to spring right now. Should families still be concerned about RSV and flu? So what should we do about this? Should we still be worried about it? And should families who actually are scheduled to have their RSV prophylaxis still go to get injections from their doctor?
Okay, well, in all this horrible news of COVID-19, there is one lot of good news, if there's any good news to be had. And that is that those of you who have children, other children at home, they're not in daycare. They're not in kindergarten. You are not going to library programs. You're not going to malls. So your babies are actually extremely well protected at the moment because you are staying at home as per the recommendations for Canada. So this is a good thing. So I actually suspect that your babies won't be probably getting RSV if they were exposed to an RSV cold virus, if they went to a library program or you have children in daycare. So that is the good news. Now, the other question I think, Fabiana, you asked me about was the RSV protective injections. So some of the higher risk premature babies population do receive RSV protective injections in the first winter. And so what I recommend is that you contact your RSV clinic or your pediatrician, whoever is giving these RSV injections, and ask them what they are doing about it. It is important to get these RSV injections, but you do have to speak to the doctors about this because each hospital across Canada may have a different plan.
That's great. And I just want to point it out that the Canadian Premature Babies Foundation website, you can just log into canadianpremies.org. We do have a lot of information on RSV. We have a podcast that Marianne talk about RSV, and we have a webinar. And we also have the criteria by province in Canada. So we know that we approach the end of the season. Some people might be getting injections until end of March or April. So the criteria is there for each province. So you can check on our website. I will make all the links available at the end of this Facebook Live on our social media channels. So Marianne, you talk about toddlers and other kids at home not going to school or daycare or play groups. And also, as an ICU parent myself, I self-isolated myself on the first year with my son. We limited visitors. We learned very well how to hand wash. So is there anything else that we should be doing during this time of the pandemic?
Okay, so there are a couple of things that are highly recommended, and I recommend them to you as well. No play groups. Please do not have friends over with their children. Unfortunately, you're going to have to self-isolate in your homes. No playgrounds. Libraries are closed, so nowhere where there are other children and other families around. For sure, you can go outside. Go outside and try to go to places where there are not a lot of people. Get your children running them down the sidewalk. Start doing exercises in the home, jumping up and down and dancing. But it's extremely important not to have family and friends over whilst we're all self-isolating ourselves. So we have to protect not only our babies and our children, but we also have to protect other people as well. Hand washing, continue to hand wash. Continue to hand wash with soap and water for at least 20 seconds when you do hand washing. And we actually prefer you to use soap and water rather than alcohol hand sanitizer. Sanitizer is for when you go out and you're going to go food shopping, you're going to wash your hands with a sanitizer after you've touched the food cart. So the alcohol also needs to be higher than 60% alcohol as well. So you need to watch that. Now, I know it's extremely difficult to get an alcohol hand sanitizer. So hand washing is probably the number one thing. People have asked about masks. Okay, so I never recommended masks when I was in the RSV program. If you wear a mask, the mask becomes a dirty Kleenex after 20 minutes. And the interesting thing about this is if you're wearing a mask and someone coughs or sneezes near you, then some of this droplet, if they are carrying any viruses, including COVID-19, that can go in through your eyes. And so don't worry about the masks. Leave the masks to the healthcare professionals in the hospital. If you are worried or you have questions about your babies or children, please call your pediatrician or your family doctor. Now, the majority of these people are actually only doing telephone call consults. The other group you can call are Telehealth Ontario, but make sure you tell them that your baby was premature, and especially in the first 2 years, what the corrected age is, okay? So corrected age, the date that your baby should have been born. If you are worried about your baby, and you feel, or child, and there are any breathing difficulties at all, please call 911. Just don't go to the emergency department, okay? Because the emergency department is full of sick people. So if you're worried, breathing difficulties, it's a 911 call. The other thing is, do not buy any over-the-counter medications for children under 6 years of age. Please call your doctor before you give this group of children and babies any medications other than the infant Tylenol. But other than that, please do not buy anything over the counter.
Marianne, we are getting a lot of questions here, and we have a little bit limited time, but I want you to answer a couple of questions that we just received. How about young children that were born prematurely and had heart surgery?
Well, first of all, I think if you're worried about that, you need to call your doctor. If your baby or child has had heart surgery, I'm going to presume that they're healthy and coping, unless, of course, these are children that have had illnesses or when they've had a cold, they've got sicker. But please, I can only talk generally. If you're worried, call your family doctor. Call your family doctor or your pediatrician. Unless some
of one more question.
Yeah.
Go ahead.
I was going to say, unless some of these children are having repeated heart surgeries, okay, that puts them probably into a higher risk. And I would like you to call your cardiologist about that.
Okay, another question. Are older preemies, 5 years plus with precious RGS in NICU, considered high risk for the COVID-19?
Children older than 5 years?
Yes.
Okay, so what I understand, children 5 years and under, all children 5 years and under appear to be higher risk. But that's not to say that any child who gets COVID-19, any teenager, any adult, we truly really don't know. So even if you have a 6-year-old that was premature or 8-year-old premature, please, it's staying home, no play groups, not having friends over, and just spending time. And I'm actually going to talk about decreasing stress in a minute if there's not a question there. It's important to keep all of us safe. And actually, some people are saying, pretend that we all have the virus and we don't want to give it to anybody else.
I think we have
to treat it.
Marianne, we were talking about not having any contact with people, really to have this social distancing. Right. But we also know this is very problematic for families who have been through trauma and now are isolated, and we worry about our mental health. So obviously I experienced myself in the first year home with Gabriel that I could not go out and I didn't socialize, and I feel very, very alone and isolated. And at this time is the whole world in the same situation. How can we make things a little better by using social media perhaps, or have a FaceTime with grandparents? What is your recommendation for us to cope well during this very stressful and challenging time that we are going through right now? Okay,
I agree. Number one, stay off the television and the newspapers. Try to minimize, because I'm attached to that television set as well. Try to minimize the amount of information, okay? And it's really important to get the correct facts. And so to go to something like the Canadian, not the Canadian Premature Baby, but CBC, They have a lot of very good information, that channel. Speak to your doctors if you want more information, but please, please, please try as much as possible to stay away from endless listening to what's going on. Secondly, time out for yourselves, time out in the bathtub, time out with a cup of tea, time out with mindfulness. If you have a baby at home and the baby's resting, lie down on the floor and do some yoga. That's really important. If you have children at home, routines are really important. Breakfast, lunch, and supper, the times always should be generally the same. Schoolwork, activities, exercises, dancing with your children in the room, jumping up and down. Going outside is very important, because going outside and being not close to people is not going to make you sick. So social distancing outside, going for walks, running with your children on the sidewalk, pushing your stroller a little bit faster if you've got a baby in a stroller. And as Fabiana said, online or social media activities. And I've actually learned how to FaceTime with my son, because he won't let me see my grandchildren, rightly so. So every morning I have a cup of tea with my grandchildren on FaceTime. And every night I have a drink or two with my daughter in Ottawa on FaceTime. And this is so new to me, but I can't tell you how much better it makes me feel, because I'm actually in self-isolation because I just came back from overseas last week. So yes, social media, Zoom. I hear people are having parties on Zoom. I have to find out how to get a lot of people on Zoom. So get your friends, talk to your friends on Zoom, put your children on Zoom. I actually spend some time with my grandchildren on FaceTime, and we're actually talking about doing activities with them, and I'm doing some card games and things like that. The mother or the single parent, what do they do? I'm surprised this hasn't been a question. What happens if I have nobody that can look after my baby and I need to do food shopping? Is there anybody that can do the food shopping for you? Is there anybody that can go to the bank or go and get medications for you? That's really, really important. If not, Fabiana, I'm not sure what the answer is. What the next line of defense is in terms of getting support for families who absolutely can't get out. But it's really, really important.
I think right now is really the time to access the village that I think we all so much crave. Who is in our village, who can support us in this difficult time. There are a lot of good groups right now getting formed on Facebook to support neighborhoods, elderly people, and parents of young children. I think it's for us to really look for help and ask for help.
Yes.
And I'm going to be self-isolated as in Sunday when I arrive back in Canada, and already organize a web of people to drop off stuff in my house, pick up my son's medication, and drop off our groceries. So I think that's the time for us to reconnect that way that we have been missing that along the years. But our time is very limited. Marianne, there is one more question here, and all the other questions that we're not going to be able to answer live right now, you can, we're going to try our best to answer over the next couple of days. Any recommendation if you're expecting a baby for the next weeks or have other children? And I think I read this information on the Public Health Canada. We are going to make that link available. Unless you have something to say now, Marianne, or we're going to post the link later.
You know, I think the recommendations about protecting or decreasing the stuff applies to everybody. So if you are pregnant, it's important that you do the social distancing, you stay home, you social media all day long. And I think that's extremely important. If you are not feeling well, or you feel that you've got a cold, or you don't know what's going on, please call your doctor. I can't stress that more, or call telehealth, okay? But I think every single recommendation applies to the premature baby, all the way up to the pregnant mom, all the way up to the elderly people.
Okay, and I just want to remind everyone that this live will be saved and you can watch later on, because we're getting more questions that we had already answered at the beginning of this Facebook Live. And there is another question: history of lung disease, PDA put them at higher risk.
PDA, PDA's closed, shouldn't. But
Okay.
again, you need to ask the question. And one more thing, actually, before I go, a lot of you are probably going to neonatal follow-up clinics for developmental assessments. That's up to you for sure. Call your clinic, call the clinic if you are not sure whether you should go or you shouldn't go. That's probably not an urgent place to go to, but certainly check it out, because I think if people are going up and down in elevators, that's not the social distancing. And I know at Mount Sinai, they told me that a lot of parents have not been coming because those appointments can be rescheduled. But please check about your RSV injections. Please check about your immunizations, because those need to be kept up to date. And kiss your baby, not on the mouth. Hug them. Love your children. Dance around the house. Do whatever you have to do to make this work and get through it. Run around your blocks, but do whatever you can. And remember that although the premature baby's at higher risk in the first year, they're saying all children less than 5, and even I'm going to say 6, 7, and 8, because who can put an age on anything? Social distancing, that is the latest buzzword.
Virtual approaching now to people. That's the new thing. But so thank you, Marianne, for your time and sharing your expertise one more time with the families in Canada. And thank you everyone who have joined us today. I will, again, this live is gonna be saved and you can watch later on and recap or keep sending us your questions, and we're gonna try our best to answer the theme for today, but also topics that are interested, please send it to us, that we're gonna go to experts to bring that information to you. We are connecting with a lot of experts across Canada. Of course, it's a very busy time for them. We are planning to do the next Facebook Live on Friday next week, 1 p.m. Eastern time. We don't have the expert booked yet because things are changing so rapidly and people are very busy, but we are going to be here live next Friday. I want to let you know also that Kate Robson is going to do a real-time peer support group on Wednesday, March the 25th, 1 o'clock. This is going to be ongoing every Wednesday. As we know, peer support groups in hospitals have been canceled. So this peer support group will be on Zoom. The links will be available on our social media channel. So please join us. Let's try not to become isolated and live in fear in our homes. There is a whole community behind you. We are all in this together. There will also be making available some resources from on our website and also on our social media channels this afternoon. We have great information from Medela. Medela website has created a lot of information on COVID-19 and breastfeeding, because a lot of families have been asking about that. The link is going to be available there. There's a lot of information on the Sick Kids website about kidshealth.ca. There's also a lot of information from Public Health Canada that we're going to make available to you later on today. So those are reliable source of information that we're going to bring to you, and please keep sending us your questions. And also follow us on all our social media, Twitter, Instagram, as we're going to be announcing the next Facebook Lives, and also Kate's link for the peer support group online. So thank you, everyone. Be well, and we see you next week. Thank you, Marianne.
Okay, thank you, everybody. It was great to be in contact with you. Bye.
Bye now.
Leave, Bob. Are you there, Fabiana?